Greetings and, of course, a very special hello to everyone looking at us right now via the stream. I am Jason Williams, media personality and soca personality here in Trinidad and Tobago, and it is indeed my honor to be part of this amazing conference, the 65th annual CARFA Health Research Conference. Of course, our theme for 2021, the pandemic, NCDs, and climate change, the Caribbean's triple threat. Of course, we're going to get into the official start of the conference later on, but of course, we will go into the special forum on vaccine hesitancy. That's the first order of business today. Of course, this year's conference, it's the 65th edition. We turned 65, but 2021 is a special one because it's the first year, the first time we are doing the conference in the virtual space. We are powered by VFairs and supported by our platinum sponsor and partner, Agence Française de Développement. Of course, the stream is coming to you live from the Trinidad Hilton and Conference Center. And we have the technical support of AV IT Support Limited here in Trinidad and Tobago. We will have our feature lecturers today. Of course, the focus will be on the impacts of climate change on our health. Before we get into the special forum, let me acknowledge the presence of Dr. Joy St. John, Executive Director, CARFA. Let me acknowledge the presence of our Chief Medical Officers, the members of the Executive and Senior Management of CARFA, members of the Research Advisory Committee. Featured speakers are Professor Hugh Montgomery and Dr. D. Campbell Landrum, conference delegates, ladies and gentlemen. As mentioned, vaccine hesitancy, of course, this is a global discussion, and it's one that we in the region are also going through that particular pace. And on a personal level, I've had discussions with many contemporaries and colleagues about, of course, that same topic. And to really get things going, I want to welcome Dr. St. John, who will do the official intros for our moderators and panelists as we get into the special forum right now on vaccine hesitancy. Dr. St. John, it's all yours.
Thank you so much. And I am actually thrilled because I am welcoming Chelsea Clinton, who is such a fabulous person in this forum of the relaxed discussion. And we're going to have a relaxed but informative discussion. And my role is to stop talking quickly. But before I stop talking quickly, I am going to give you a little bio on the three members of our panel. So first, let's start with Chelsea Clinton. As Vice Chair of the Clinton Foundation, Chelsea Clinton works alongside the Foundation's leadership and partners to improve lives and inspire emerging leaders across the United States and around the world. This includes the Foundation's Early Child Initiative, Too Small to Fail, which supports families with the resources they need to promote early brain and language development, and the Clinton Global Initiative, CGIU University, a global program that empowers student leaders to turn their ideas into action. A longtime public health advocate, Chelsea holds a Bachelor of Arts from Stanford, a Master of Public Health from Columbia's Mailman School of Public Health, and both a Master of Philosophy and a Doctorate in International Relations from Oxford University. She lives with her husband, Mark, their children, and a dog in New York City. Welcome, Chelsea. I'm really excited to see the magic that you will bring to our little forum. Next, I welcome Dr. Rashad Massoud, who has served as Senior Vice President and Chief Program Officer at AmeriCares since September 2020. In this role, he oversees the organization's health programs for people affected by poverty or disaster, its emergency response team, and its global distribution of more than 900 million in medicine and supplies to more than 90 countries annually. He also leads AmeriCare's global response to the COVID-19 pandemic, including the distribution of PPE, delivery of essential primary healthcare services, and training and mental health support for frontline health workers. Welcome, Dr. Masood. And last but by no means least, I welcome Dr. Karen Broome, who has served as an immunization advisor for the Caribbean region at PAHO since April 2020. Previously, she worked in the Barbados Ministry of Health for over 20 years with me, including serving as the country's national immunization manager from 2014 to 2020. Dr. Broome holds a master's in public health from the University of the West Indies and brings a lot of practical experience to today's discussion. So thank you very much for joining us, and over to you, Chelsea, so that we can enjoy this panel.
Well, Dr. St. John, thank you so much for welcoming us so warmly, kind of in this virtual space, but kind of very much grateful to be in kind of actual community with you here today and with all of the participants. And I just want to say how honored we have been at the Clinton Foundation to have worked with you, Dr. St. John, in so many different capacities over time, including now kind of on the important, urgent issues of building vaccine confidence throughout the Caribbean, really throughout our hemisphere and across the world. And Dr. Broome, I hope that we could start with you, given your role at PAHO, kind of focused on immunizations over the last now year plus, but also kind of with all of your previous experience, where I think in kind of every role you've had to really work on kind of answering questions and combating hesitancy around vaccines and really building trust in vaccinations. Could you kind of just give us a snapshot of kind of where we are at the moment in the Caribbean in terms of COVID-19 vaccinations, and kind of also where we are in terms of vaccine hesitancy?
Thank you so much, Chelsea. And let me say, it's a pleasure to be here. And I thank CAR for allowing PAHO to have a voice in this very, very, I think it will be very useful and very interesting discussion. The Caribbean, from the time that we understood that COVID-19 vaccine would be a possibility, we started to plan. It was amazing how the healthcare providers, the logistics persons, from persons use some of their volunteers and civil society, and the whole immunization program started to plan. With the assistance of PAHO, we were involved in all of the planning so that when the vaccine came, the deployment and the administration would work like clockwork. Because a lot of people just don't understand, it's not about just getting that vaccine from the vial into the arm. It's getting that vaccine into the country, and then how do we store it? How do we deliver it? Who administers it? In what conditions? How? And the Caribbean has really stepped up in terms of the strategy and the whole campaign for the COVID-19 vaccine. I'm sure we are aware that we have a long, rich history in vaccination in the Caribbean, and we actually have been world leaders in terms of childhood vaccination. So we wanted to bring that same focus of the childhood vaccination and all that, our platforms and all that have made us successful, and also put that into the vaccination of adults in COVID-19 vaccination. The campaigns really started well with the administration and with the help of healthcare workers, who some worked around the clock. And the populations really came out and were excited and wanted to be vaccinated. So we started really all guns blazing. And in each country, persons were excited and encouraged each other to just come out and be vaccinated. Of course, as the campaigns have gone on, those early adopters and those ones that are excited and the ones who have read a lot of vaccines, seen the positive benefits, have come on board and they've become vaccinated, they've gotten vaccinated. Of course, we started with our priority groups, which is the elderly and the healthcare workers and those who would be at risk. So very good administration. And we continue to encourage people to come out and be vaccinated. So right now, we have done all of those who have come to access, and we're going for those who we need to meet in their communities. So we're going into the communities now to ensure that every single person in the Caribbean has access to COVID-19 vaccine.
And Dr. Broom, could you also just share what kind of barriers of not access, because I think more than aptly pointed out, it's not just about kind of getting the shot in the arm, it's about ensuring the shot is there to be put in the arm. And we certainly have had lots of access challenges here in the United States as well. But like presuming like the shots are there to be kind of put in the arm, that it's not a metaphor, that it's actually something can happen. What are the kind of hesitancy barriers that you have seen kind of from your position at PAHO really across the Caribbean? And also, I think importantly, what have you seen to help people who maybe initially were hesitant then make the decision to be vaccinated?
Right. We have seen that hesitancy waxes and wanes. So sometimes you have quite a number of people who are hesitant. And then as time goes by, those same people then become quite comfortable with taking the vaccine. And it's for different reasons. Some people just need time. Some people need time to assimilate the information, time to become comfortable with the benefits that are promoted. So over time, those people who might have initially been hesitant have come forward. Others have benefited from champions. So whether that has been their pastor in their church, whether that has been a community leader, whether that has been a sports person, a popular sports person that has come out and said, listen, I have been vaccinated. And we find that the influencers do a good job in bringing people, in educating persons, in talking about the benefits, but also talking about what people's concerns are. And some concerns are about side effects. And we've done a lot of education about side effects. We've launched in our communication campaigns, we've had specific posters and videos just speaking about side effects. And we have also done that with adverse reactions. So it is all about the communication, the communicators, and the information and how we target the information to the specific population.
So Dr. Broom, I think so much of what you just said may seem kind of so obvious and clear that we need to have messages rooted in science that are accessible and understandable to people, delivered and consistently delivered by trusted messengers. And yet we know that choreographing all of that can actually be quite challenging, and doing it kind of in a consistent way, because unfortunately we know that kind of the kind of anti-vax community is always kind of communicating, unfortunately, that we have to also always be communicating kind of messages rooted in science, rooted in evidence, and rooted in facts. And I wonder now if we could turn to Dr. Masood, who I know kind of with AmeriCares has been doing so much work here in the United States to help support vaccination efforts across the country, and really have recognized all along that to effectively support vaccination efforts, we have to have communication kind of not just as an afterthought, but very much kind of integrated into how we talk to people about vaccines and vaccinations, how we answer the questions along the lines of what Dr. Broom was kind of sharing in the Caribbean questions about what is the vaccine, kind of what side effects might there be. And so I just wonder, Dr. Masood, if you could now kind of join us and share what you've seen from your AmeriCares perspective to work really well here in the US, what maybe hasn't worked as well, to possibly just kind of provide further insight that could be actionable in the Caribbean or candidly anywhere. Well, oh, I think you're on mute, Dr. Masood.
Oh. With pleasure, Chelsea. Thank you. In our work at AmeriCares, one of the things we observed is how patients are influenced, how people are influenced to receive or not receive their vaccine. And one of the big factors that we realized are the health workers themselves. So if somebody goes to their physician and their primary care physician who takes care of them for everything else recommends that they get vaccinated, the likelihood is they will be more open to being vaccinated. So that's something we've been seeing in our work at AmeriCares over and over. More recently, we were very fortunate that CDC has awarded us an opportunity to work on vaccine hesitancy amongst the health workers themselves. Now, the idea is that, yes, a good proportion of the health workers are actually vaccinated themselves. However, there is a proportion who are not, and in working with those who are not, we're more likely to be able to influence them in such a way that they also influence their patients. So we're trying to reach the community through the health workers. That would be one of the major ways in which we can get there. It goes back to opinion leaders. Every social system, every social sector in that system listens to certain individuals, and we do know that people for their healthcare do tend to go to their physicians. We do know that they tend to listen more to them, and so trying to affect that chain is at the heart of what we're trying to do here. We're doing this in the US throughout the country, but we're also working in Puerto Rico and in the US Virgin Islands in that same activity.
Dr. Broom, I wonder, if we could then return to something that you said earlier, which is that, historically the Caribbean has been a real leader in childhood immunizations. I mean, in many years, the Caribbean does a better job than the United States does, actually, vaccinating children against kind of all vaccine preventable, childhood illnesses. What do you think, because you alluded to this earlier, kind of what do you think kind of all of those historic successes helped prepare you then to be effective communicators for the COVID-19 vaccines? And also, how do you think it is different when we're talking about an adult and now an older kind of child population versus when we're just talking about kids? So kind of what has been similar and what has had to be different?
Thank you so much. I think that is a very insightful question because a lot of persons just believe it's just immunization, but your target group matters. If it's children, it's a different messaging to if it's adults. And traditionally, adults have not been a big category for vaccination in the Caribbean. We have learned what transitioned well was we have learned that the messages have to be targeted, that we have to listen, that we can't assume what is causing persons anxiety, because that's when you go off track and your messaging doesn't hit that spot. So a lot of social listening had to happen. We had to do surveys. We had to be listening to what people were messaging on WhatsApp. We had to do a lot of focus groups. So the listening to the community was extremely important. The difference was that with children, you get that one-on-one when that parent comes to you. You can start even before when mommy's pregnant and you have parents there. You talk about immunization, you introduce it. COVID didn't give us that leeway. It was COVID is here, we're in a pandemic, the vaccine will work, and there was the vaccine. So a lot of the preparatory work and a lot of the experience about, oh, we've been doing this for many years, it wasn't there with COVID-19. And the speed of the development of the vaccine caused people concern as well. So it was about targeted messaging, listening, social listening, so that we could understand the hesitancies, and then messaging and working towards getting out that information, and also making sure that we had the right people carrying that information.
Important. And those are the people who are hesitant for one reason or the other. And those reasons are many. And trying to, and they range from things like misinformation. A lot of things that are on social media are just not true. They also have political connotations in some places. They also have the idea that, well, let me not be the first one, let me wait and see. Or in some cases, we've also heard people say, well, you know, if I have to, I'll get it, but if I don't have to, I won't. So we need to understand all of these subgroups. What Dr. Broom was describing early on is at the essence of this. We need to dig deep, understand the reasons why different groups and different populations, and they're not going to be the same in any one place, why they are hesitant to get vaccinated. Why are they hesitant to continue complying with the precautionary measures? And understanding those reasons then allows us to devise the types of solutions that will work. We do know one thing for sure, which is information on its own is not good enough. It's important, but it's not the end-all be-all of solving this problem. We need to dig deep. We need to understand those causes. We need to devise solutions, and we need to understand how things spread in society. Who are the opinion leaders who can affect different groups in different places? We have a lot of work ahead of us, and we're just at the beginning of this work.
Dr. Masoud, I think you said so much that is so important. I mean, kind of for so many people who haven't yet gotten vaccinated, that's how I like to frame it, admittedly. They haven't yet gotten vaccinated. Not that they won't, but they just haven't yet. You know, there are often so many questions that people have, you know, which both you and Dr. Broom, you know, kind of nodded to in your various comments, like your questions about, wow, how did this happen so quickly? Like, how can I trust something that happened so quickly? Or, you know, different questions like, well, like I'm 22, if I get sick from COVID, is it really that big a deal? And I'd maybe rather roll the dice for that instead of like have a sore arm for a couple of days, right? So many different kind of questions and concerns, each of which of course merits kind of its own answer and the continued answering, because often we know these are our conversations over a long period of time. But, you know, Dr. Masoud, you also said something that directly relates to a question that we just got from someone kind of who is watching us now, which is that kind of how does information spread? And we know that while kind of the hardcore anti-vaxxers aren't the kind of majority of those right now who haven't yet gotten vaccinated, they are unfortunately quite effective communicators. And they really have, I think, kind of preyed upon kind of what they recognize as a real market opportunity for them over the last kind of 15, 16 months of COVID. And they have grown their reach, you know, quite painfully through the major social media platforms. And, you know, I was talking to my friend, Dr. Peter Hotez, who is a kind of vaccine scientist here in the United States recently. And he had written a book that had just come out on kind of COVID-19 and the development of the COVID-19 vaccines. And the first like 30 entries on Amazon were all anti-vax books, and his was like number 31. So he's like, mine was the first science-based book, but unfortunately it was the 31st book on the Amazon ledger. So while we spent a lot of time kind of focused on how misinformation flows through WhatsApp and Facebook and Instagram, and I certainly think the social media companies do a lot more to crack down on misinformation. It's not only kind of through the social media platforms that the misinformation at the moment is flourishing. So you said, Dr. Masoud and Dr. Broom, that we know that kind of, facts on their own aren't sufficient. And I just want to ask, I know we don't have a lot of more time, but since we got this question, I want to give you both the chance to answer it. Question for the panel. It said, Ms. Clinton stated that the anti-vaxxers are always communicated and we need to communicate with facts. Is that actually sufficient to change minds? Especially considering, hesitant persons seldom use any science or reasoning in their arguments. So what can we do? So this is a question that was submitted. And when I think, Dr. Broom, I want to give you the chance to answer it, and then Dr. Masood.
Thank you. I think that it is everyone's responsibility when you receive information to check to see if it is accurate, if it is scientifically correct, before we forward and help to spread misinformation, which can actually cause harm. There are, and we talk about it, either PAHO, their ministries of health, CDC, WHO. There are so many sites where you can go to find accurate information. There are so many places. You have your healthcare providers at the clinics. You have your private doctors that can provide you with information. But I believe that the emotive aspect of some of the messages causes people to be anxious and say, oh, look at this. And then we ourselves are responsible for sharing some of that misinformation and some of that information that has just been shared and is completely not true. And it preys on people's fears and anxieties. And I think that we need to break that link, that every single person needs to take that responsibility to break that link. Before I share, what could happen if I share this? Before I share, have I checked to see if this is true? Before I share, have I asked the person who sent it to me, where did this come from? So I think if we break the link, we can stop a lot of misinformation, and we can stop the spread and the whole hand or hold that some of the anti-vaxxers have on some of the population.
And Dr. Masood, any additional thoughts, please?
Sure. So in addition, I think you said, a 22-year-old who might not think that this is a big problem for them. Well, if it's maybe it is not, but it is a big problem for their parents and for their grandparents, and that's something they need to look at. And also, if the virus continues to circulate, well, one day they're going to be in their 40s and 60s and 70s, and it will, come back to them. But then, I think you brought up another big issue, which is we've relied in our profession, we've relied on sort of like the authority to speak. We've relied on the doctors, we've relied on and it is high time for us to be thinking about everybody, a social movement for health, getting young people to speak up, because nobody will affect the young people like their peers. And if we can get some peers to be speaking out, I think we would be in a much better place.
Well, I think that's such a wonderful note to end on, especially given the presenter who welcomed us was saying that he was talking to his friends and colleagues about kind of vaccines and vaccinations. So I think, Dr. Masood, what you are saying is that this is all of our responsibilities to be kind of talking to our friends about the importance of vaccines and vaccinations, is kind of what Dr. Broom was kind of enjoining us to do, to ensure that we're only doing it kind of rooted in facts and kind of not passing on things that, even if we're passing them on to say, oh my gosh, can you believe this, that's giving it more kind of oxygen than it merits. So ensuring that kind of each of us is faithful to fact, science, evidence, and to supporting conversations very much kind of in our doctor's offices, but also kind of well beyond in our own lives. So just thank you both so much for kind of what you're doing with PAHO and with AmeriCares. And I just think we have to all keep being open and not only open, but engaged in these conversations, because as Dr. Masood, I think, rightly pointed out at least a couple of times and maybe more frequently, while we may be tired of the virus is not tired of us and is very much still with us, and very much will be until we can ensure that everyone is vaccinated. So just thank you both so much. I want to ask Dr. St. John to come back kind of onto the screen if she's here. I think that she's supposed to be joining us. Yes, there she is. And I just got a note that we are supposed to take a photo. So I don't quite know how that's happening, but I guess we all just smile and hopefully like there'll be a photo taken, and then we'll hand it back to you, Dr. St. John.
I want to thank you, Chelsea. It was such a lovely session. And the information was a lot, but imparted so gently. It was easy to absorb. Thank you so much, Chelsea.
Thank you so much, Dr. St. John, for having me and for having us. And thank you to CARPA.
Ooh, they split the screen. But what about the rest of us? Dr. Broom and Dr. Masood? For the pictures. Oh yes, I should take a picture too, so then I could tweet it. Yes, bring him in too. Bring in Dr. Broom. Ah, good. Lovely.
I took a picture too. Why not?
Yes. Lovely. Have you all taken the picture? Okay. I think we're done now, Janice.
All right. Thank you so much, everyone.
Thank you.
Thank you. Bye-bye.
Bye.
Thank you so much to Dr. St. John and the panel. I must say it's the first time I've seen a virtual selfie with folks in different parts of the world taking a picture at the exact same time. That's the power of the technology. And I'm happy that we were able to get perspective, insight, and obviously learn about the plans afoot as we address this particular issue of vaccine hesitancy. It's a conversation, as I mentioned earlier, I always conduct with friends and contemporaries. And as they would have said during the discussions, during that special session, information is indeed the key. With that being said, I have some more information to bring to you as it relates to day 2. Of course, we're going to take a small pause, take a break, and then we're going to come back later on with, of course, some of the main lectures. In the meantime, let me remind you about our conference hashtag. You can hashtag CARPHAConf. So that's CARPHACONF, of course, an abbreviation of the conference word 2021. You're going to see it, of course, on the screen. And you can access also the CARPHA Conference app. Remember to download the CARPHA Conference app if you don't have it already for access to the WIMJ supplement with conference programs and abstracts. So lots of details, of course, more to come during the course of the day. We're going to take a small pause and we will come back after lunch for the official start of day number 2, 65th edition. And of course, the first time we are going to the virtual space. Before I take that pause for the lunch, let me again acknowledge some of the countries here with us, people who are locked in. Beautiful Antigua and Barbuda. Of course, Barbados here with us, Belize, Bermuda, BVI, Bonaire, Guadeloupe, and Guyana, just to name a few. I have, of course, many more to mention. So stay with us. Stay right where you are. We come back in a couple minutes as we get day number 2 on the way, right here inside the CARPHA Conference, 65th edition. See you momentarily.